Thank you, Mr. Chairman. Good morning. Thank you for welcoming me to iFixit Ganga. So the topic is we are not small adults, 10 reasons why and how our fractures should be managed differently. This is the children telling you how they want their fractures to be managed. So as Sir mentioned, opening batsman, probably because there's a passing resemblance between me and another opening batsman. So first thing, this is a typical scenario. You have an anxious child with a fracture, typical type 3 supracondylar. First thing you do is not fix it, examine the child. A lot of times we miss examining the child properly. Sometimes there are neurovascular injuries that are sometimes missed, and then post-op we find that child has a nerve injury and you don't know whether it is pre or post. So the first thing that the child wants you to do is assess me properly. So these are all examples of fractures in children that are unusual because children have different anatomy. Blood vessels do not cross the physis after 18 months of age. So when you have fractures close to the physis, then blood supply can be affected. So the second thing the child wants to tell you is my blood supply is different. So always bear that in mind. And not everything shows up on X-rays. That's a typical lateral condyle fracture, but what we miss is the fact there's a huge cartilage fragment that is not visible on the X-ray, but we need to be aware of it in order to manage the fracture properly, because there are various configurations that can happen, and you will discuss these as the course goes on. So there's another seemingly innocuous small bony fragment, but actually there's a large sleeve fracture of the patella which doesn't show up on the X-ray. So the third thing that the child tells you is I have a lot of cartilage. So always keep that in mind. And we know that children break their bones differently. They have different mechanical properties, lower modulus of elasticity, lower bending strength, but their bone is able to absorb more energy before failure. So they get different patterns, in particular plastic deformation that typically is again missed in a typical ER department where there's no fracture to see. So plastic deformation is easily missed. So the third thing the child tells you is my bones have more collagen. So I'm not a small adult. So it's important to treat the whole child and not just the skeleton. These are all examples of fractures in children who have other bone pathology. And again, we need to manage their bone pathology in addition to managing the fracture. And if we don't do it properly, then complications can happen. So the fourth thing is don't forget that I may have a bone disease. So there's a 3-year-old boy, undisplaced metaphyseal tibial fracture. 6 months later, he comes with genu valgum, and the reason for that is something called Cosen's phenomenon, which is something that happens in children. So it's important that you educate the parents and tell them that such problems may happen in the post-op period so that it doesn't come as a rude surprise to them. And it's also important that you make sure you follow up the children. So the physis is a very important structure. It can be a good thing where it helps you remodel minor degrees of malalignment and angulation, etc. But it can also be a force for bad, where if there's any damage to the physis, as a result of trauma, it can cause secondary deformity and problems. So the next thing that the child wants to remind you is that he or she has a growth plate, and we should always be respectful of the growth plate. So all of us know that bone, when it heals according to two particular laws, Wolff's law and Hoyte-Workman law, and both of these principles are operation in children, such that bone is laid down on the compression side and taken away from the tension side. That's Wolff's law, and of course Hoyte-Workman law. And 75% of bone remodeling happens at the physis. So the other thing that particularly in India is a problem is how do we fix these? And there are special implants available in children, for children, and increasingly implant manufacturers are able to provide specialized implants for us. And frequently as pediatric orthopedic surgeons, we see that adult surgeons, because they don't have access to specialized implants, sometimes cut corners, and problems do happen when you try to use adult implants on children. So whenever you're treating pediatric fractures, always have some backup in place so that even at short notice, you can get the right implant which is most appropriate for treating that particular fracture and in that particular case. So children say that we are special, so use special implants. And of course, if all else fails, you have to call your friendly neighborhood pediatric orthopedic surgeon. I think there are enough of us all over the country, and we are always willing to help you think through and plan the management of fractures, just as we are doing today, but also on an ongoing basis through social media. You can just pick up the phone and call us anytime you have a problem, and we are always happy to help you plan the management of the fracture, and you can go ahead doing it, because the actual treatment of pediatric fractures is not all that difficult, but thinking about pediatric fractures and planning the management, I think, is much more important. And that's where we typically go wrong. So we have trained pediatric orthopedic surgeons all over the country who can help you do this important role that we have to make sure that children grow with a normal skeleton and they are restored to full function after any sort of trauma. So whenever in doubt, help is just a phone call away. So just as children learn the ABCs when they go to school, when we manage children's fractures, we also have to learn our ABCs, assess the child properly, remember their special blood supply to certain parts of their bones, remember that their cartilage is different, their collagen is different, they may have bone disease. It's important to educate the parents and follow them up carefully. Always remember the growth plate and have due respect for it. Remember that we have the Hoyter-Workman law and the Wolff's law of bone that's going to help us remodel many fractures, so we don't have to go around fixing every single minor angulation. Remember to use special implants and ask help when needed.